Medical first aid. Introduction to the module. Every cabin crew is trained in first aid on a mandatory basis for attending to passenger sickness and/or injuries. First aid kits contain various medicines and equipment and are supplied on board for cabin crew members to utilize these supplied provisions for rendering necessary treatment to the occupants who need it. Topics to be covered in this module: First aid kit and physician's kit. General duties of cabin crew for administering first aid. Ailments arising from flights. First aid kit and physician's kit. First aid is such action that either cures or at least restricts the illness from aggravating further till the time a qualified medical practitioner attends the sick person. However, if the sickness or the injury is of a major nature, the cabin crew could make an announcement to seek the cooperation and help of a doctor traveling aboard. The physician's kit contains various life-saving medicines and sophisticated medical equipment. If any doctor or a trained nurse is available on board, he or she alone can have recourse to the physician's kit. These are packed analogously to the first aid kits. Both these kits are sealed metal boxes, normally painted in bottle green with a white cross on it. These boxes are stowed to withstand jerky conditions and remain unmoved from their location in turbulence. The contents are packed inside the boxes in such a way that they remain unbroken and usable, even after experiencing violent judder. The medical officer of the airline maintains the validity and the quantity of the contents of each box. Engineering personnel furnish the box to the medical officer. He or she, in turn, deposits the relevant medicines and other equipment, carefully observing the usability or quality, the expiry date, and quantity. A list of contents with supplied quantity and a user's form, in triplicate, are also packed inside the box. The box is then wire sealed by the engineering personnel in front of the medical officer, and a label signed by the medical officer, indicating the expiry date of the kit, is pasted on top of it. These kits are a part of the emergency equipment of the aircraft and stored in engineering stores. The engineering staff replace these whenever the existing kit on board the aircraft has been reported used. Normal contents of first aid kit. The contents of first aid kits may vary in their number or brand, but usually remain the same. The list of items is as follows: medicines. Air sickness tablets for air sickness, nausea, vomiting, etc. Buralgon tablets for severe abdominal pain, etc. Mixoform for stomach trouble like dysentery, diarrhea, severe abdominal pain, etc. Saradan tablets, aspirin, for ache and pain. Sodamine tablets for indigestion, hyperacidity, etc. Halazin tablets for water purifying tablets. Liquid coramin drops for weak pulse and respiration. Smelling salt for fainting, exhaustion, and depression. Dettol, antiseptic lotion, for cleaning and disinfecting wounds and equipment. Burnol antiseptic soothing paste for burns. Turamicin eye ointment for infection, irritation and injury to eyes. Nasivian nasal drops for nasal ailments. Materials. Roller bandages to retain dressing in position. Triangular bandages to use as sling. Absorbent cotton wool to clean wounds and to act as padding. Absorbent lint, absorbent cotton or linen for wiping fluids. Absorbent gauze linen for absorbing fluids. Adhesive plaster to retain the dressing on small cut or wound. adhesive strips for small cuts, safety pins to fix the end of the bandages, wire splints for immobilizing broken bones equipment, tourniquet to choke bleeding, pair of scissors to cut items as per requirement, artery forceps to stop arterial bleeding, LAIF resuscitator for administering artificial respiration. Normal contents of physician's kit. The general injections and instruments stored in a physician box are given below. Injections: injection Durifilin, injection Paraldehyde, injection Fortwin, injection Centomedrin, injection Adrenaline, injection Largactil, injection Micaron, injection Gardinal sodium, injection Decadron phosphate, sorbitrate tablets, instruments, thermometer, disposable syringes, stethoscope, blood pressure measuring instrument, sphygmomanometer. Precaution: a doctor or a trained nurse alone is authorized to use the physician kit. General duties of cabin crew for administering first aid. While administering first aid, cabin crew are to follow certain general principles as cited below. These are to be adopted in addition to any and/or all treatments rendered by the cabin crew, and to be followed as a conventional practice and guideline, such as: act at the earliest and do all that is needful systematically in the appropriate sequence from first to last. Cabin crew members should not panic, and if they ever do, the same should not in the least be revealed through their appearance, action, and body language. Reassure the patient throughout the treatment and periodically thereafter. Do not allow others to crowd around the patient unnecessarily. Do not overdo things. Stick to basic treatments to save a person's life and/or to prevent his or her condition from aggravating and/or worsening. Solicit help from a doctor or a qualified nurse traveling aboard. Make an announcement over the PA system for invoking such succor. Follow up the case till it does not become absolutely indispensable to do so. Keep the commander and the cabin crew in charge informed periodically about the happenings or developments throughout the episode.